Mr. Jay Singh. How has technology and innovation been introduced into hospitals and clinical care in recent years? And what do you see as the most impactful innovation in the clinical setting?
All innovation must ultimately result in better outcome for the patient, because innovation is not happening just for the innovation's sake. For cancer care, we chose the tagline, every life matters. So, if we can make a difference to every person's life in a disease like cancer, here where we had such a tremendous gap in the care, you got to really focus how innovation is able to impact the quality of care. On the radiation technology, for example, there have been tremendous advancements, but the gap is that a lot of radiation oncologists here in India get trained and receive their master's degree on outdated machines. So unlike in US, where we are, the academic centers deploy the very latest technology, and sometimes even the technology that are being tested are in the academic settings. Here in India, just the reverse has been the case. So the gap has been also in finding people who can use that innovation in technology to deliver that standard of care. So it's the whole continuum. So in the hospital setting, that has been one of the challenges. Not producing enough people who can leverage the innovation and convert that into patient outcomes is an area of concern, and we've been really working in that area.
I have a question. You mentioned about the lack of latest state-of-the-art equipment in the Indian hospitals. So is that changing? Is government bringing state-of-the-art so that the people who are going through the education, they are going to get exposed to that? And how open is the Indian environment for doing clinical feasibility studies on new ideas, new innovations on actual patients?
The technology deployment in the government hospitals continues to be a big challenge. Private sector healthcare in the last 7 to 8 years, I would say, has brought in the latest technologies, especially in a hospital setting. A linear accelerator is probably the most expensive equipment. So we have seen large number of hospitals bringing even that technology comfortably. But unfortunately, that hasn't been the case in the government setting, and a large number of people would like to have access to that, because there is a limitation of pricing and the affordability in the private sector hospitals, and the poorer section or economically weaker section of India having the access and the affordability for that care. So that cannot be a good situation. So we got to find ways to do that. So overall, there is across the board need for significant technology upgradation and higher technology equipment and all being deployed in hospitals, not just in metros, but at least in the state capitals, where a lot of people from smaller towns tend to come. That is one. On the other part of your question was on the clinical research and development. So I think the environment right now has not been most conducive for that. The whole support system, regulation, how the trials get structured. For example, we run HealthStart, which is India's first healthcare incubator accelerator, and there, even if we want, we haven't been able to really create a dedicated focus on devices side, because that's a complex problem to solve. So right now we are supporting companies that are leveraging technology or creating digital health models and other things, but on the devices side we see much lesser number of companies in the first place. And the second thing is, whether IIT Delhi or AIIMS, whether they are on the same campus or not, but at least there should be a way for them to talk. So that is more important. The campus doesn't matter. So good part is, at least in the last 3 years, I have seen that a lot of engineers who had nothing to do with healthcare are creating healthcare startups. That is a very encouraging trend. But I think more needs to happen, and even on the accelerator incubator side, we would like to get really sustained support from the devices manufacturers, from the pharma companies, and from the government to really strengthen these efforts, because more such efforts are needed.